Hello, everyone. My name is Naveed. I'm a physician assistant. I work at St. Alexia's Hospital with private physician Dr. Hamiduddin, and I have been working as a PA for 20 years. Here today with a patient that we've been following since March 30th with COVID-19, and we would like to share our experience regarding his COVID symptoms. And he has been here for approximately 3 weeks. What is your name?
My name is Nick.
How long have you had the symptoms prior to coming into the hospital at the end of March?
I would say my symptoms first showed up around March 21st. They commenced with just a standard body chill. By the second day, it progressed to chills and just very heat flashes in essence, where I would just start sweating profusely out of nowhere and then quickly revert back to body chills. By the third day, I progressed to a fever and still body chills at the same time. And then I would say between day 5 and 6, I started to develop a cough whenever I would talk.
Is this prior to you coming into the hospital?
Yes.
Okay, that's prior to coming into the hospital.
I went to get tested that Wednesday and got my results on Friday. And by Friday and that weekend, it got to the point where I could barely talk.
5 days, 7 days, would you say, since you were sick? Okay.
Yep, about 5 to 7.
Okay, so Nick came in about 7 days after his symptoms had started. He thought he could manage them at home with some cold remedies and things like that, but obviously that didn't happen. Then what prompted you into coming into the emergency room?
What prompted me was that I thought I overcame the fever and I didn't. And then between that, the cough. The cough itself is what very extremely lingered, and everyone else that had gone through COVID that I would talk to, they're like, what you're going through right now isn't normal. I started to feel better within a certain time range. And they're like, they suggested that I reach out to the emergency room or call a doctor just to see what they would suggest. And the one doctor that I called online also suggested that, like, if it's progressing like this, you need to move to the next step and do what's right. Listen to your body. Your body is not healing properly right now.
Right. So when he came to the hospital, he was in the beginning not as short of breath as he was towards his as the time progressed. He started becoming very short of breath, and then we started giving him oxygen. We started giving him more and more oxygen. He was up to 40 to 50 liters of oxygen, and his symptoms would not get better. He couldn't even speak as he's speaking to you right now. Every time he spoke, he became short of breath. Every time he turned or stood up, he became short of breath. So we even involved the cardiologist, pulmonologist, trying to figure out what is causing him not to get better. What makes Nick's case so interesting is that he's so young, and he's only 40 years old, and he has not had any medical history or underlying diseases like COPD or CHF or diabetes, any of those things. He's a healthy individual who works at a office job, and he's been doing well. He had not had any prior history of asthma or anything else. So that's what makes this case so interesting, is that he had required high levels of oxygen. And Nick, how did you feel what was going through your mind when we told you that you're not getting better? We've tried everything, including antibiotics, including all of the new medications that we have, the remdesivir, the plasma. We've tried everything on you, and still you continue to feel sick, and you couldn't get better. So how did you feel when we told you that you are at the verge of being intubated? How did you feel about that?
Honestly, I could tell with like the way that the verbiage and the words were changing. It would always be more like, I'm really young, I can overcome this. And then eventually it started to become more like, we're hoping that this is going to be the next step that's going to help you overcome this. And that's when I knew that this was going to require a little bit more time, and it was potentially going to become, can I outlast this? Can I do everything in my power to set myself up to keep myself calm, stay patient,
And breathe.
and just breathe. Concentrate on the things that were within my control versus thinking other things and letting my mind spiral down. I knew that I had just one mission to do, and that was just to worry about breathing and worry about keeping myself as calm as possible.
Right. That was one thing that I had to keep suggesting to Nick is stay calm. He had to be laying prone on his stomach, in his abdomen, most of the time, and he couldn't even talk. So only thing I kept telling him is please stay calm. And I think one of the specialists even came and told you that if you could make it through one more day, then you would make it. Otherwise, there might be a possibility that you might not make it.
Right.
And at that point, we reached out to his family and we explained that there is this possibility that he might not make it. But he survived, and this is, I think, day 20, I believe.
Yes.
We are hoping that we can, right now he went from 40, 50 liters of oxygen to, with non-breather and everything, and now he did not get intubated, thank God. And he was in the ICU. We transferred him into the ICU to possibly intubate him, and then we were able to get his symptoms under control. We have a great team in the ICU, and then he was brought back to the medical floor. Then he remained on approximately 8 to 10 liters of oxygen the last few days, and now we are down to 2 to 3 liters of oxygen.
Yes.
And we're hoping by tomorrow we can get him, our hopes are that we can get him off the oxygen completely by tomorrow. However, there is a possibility that Nick might go into going home. He might be going home with oxygen. There's a big possibility for that tomorrow. So we will see what happens tomorrow. But how do you feel right now? How do you feel about how well you're doing right now, and what would you like to say to the audience?
Honestly, you really have to take it as a day-by-day process. There's no shortcut. There's nothing else that you can really do outside of just having full trust in not just yourself and your body, but the people around you that are trying to work together and pull together to help you get that strength that you need to help you overcome and just outlast everything, and give all the medications that they're giving you that chance to finally work together and click and just start battling, whether it be just COVID or COVID pneumonia. It starts with us and our mentality. And
how are the nurses? How are the doctors? How is everybody treating you here?
I want to say that's part of the healing process, and part of what helped me overcome this is that the staff and the support. Every night, everyone made sure that I was taken care of, that all of my questions were answered. Even in the darkest moment where I'm just having fever dreams and, freaking out, internally a little bit, they come in and they're fully prepared. They draw my blood, and they reassured me every time too that I'm doing well, that I'm fighting. But at the same time, I'm breathing. Breathing is the key to all of this, is that staying prone, laying on your stomach, breathing in like you're smelling a rose, and then exhaling out like you're pursing your lips to blow out a candle. Doing all those little movements and just concentrating on that is what helps you and your lungs start to heal, but also push out that air and allow your blood oxygen levels to circulate properly. That's really what kind of just helped me hone in on everything, is just breathing in the roses, blowing out a candle to make sure that I'm doing everything in my power.
Exactly. And we're also wanting to make sure that you understand that you also have to, once you get home, you might not be back to your normal self and not back to your normal job right away.
Right.
And you're also very lucky to have a job that they're working with you in getting you back and giving you some time to recover once you get back. That's
Correct.
Also very important, folks, is that you can't just jump right into your life as soon as you come back home from the hospital. It's going to be a process, and that process can take some time. It's not going to be very simple, very easy, like you just got over a cold. And that's another thing we prepared Nick for, is that he needs to be prepared to stay home a little bit longer and make sure that he is stable to go back to work and go back to his normal life.
It's all the little things, really. You don't really think about these things because they're automatic when we do them, but everything that we do uses oxygen. Whether I'm just doing this, moving around, talking, moving my head, all of that affects my blood oxygen levels as I'm testing out and reading and seeing how everything is going, getting up to eat breakfast, taking a sip of water, taking a sip of my soup. All of that consumes oxygen. And again, it always goes back to just staying alert of how you're breathing, just to give yourself that chance to recover your blood oxygen and do what you got to do to get through the day. Like we said, no shortcuts. Day by day, every little day I notice something improve. But I know that there's a long journey ahead of me with all of this. But I've got this wonderful staff and this awesome team that has helped get me set and get me back to this point where I can now think about recovery.
Thank you very much for your time, and I hope that you like this video that we made. We just wanted to make sure that everyone knows that not everyone that has COVID is gonna end up dying.
Yes.
You can make it. You hopefully will make it. If you do, there's different types of COVID symptoms, different kinds of COVID patients, depending on underlying and not underlying diseases. Like in this case, there was nothing underlying, but he still ended up being very, very sick. We're so lucky to have him back. We're lucky that we're able to share this with you.